Hello, my name is Dr. Dmitry Tsvetov, and today I'm going to answer a question of whether a patient is a candidate for all-on-4. That question can be answered by simply looking at whether a patient is a candidate for implants in general. The factors that determine whether a patient is a candidate for dental implants include factors such as generalized medical health, people with underlying conditions such as uncontrolled diabetes, or patients who are taking immunomodulatory medications for control of, for example, autoimmune diseases or arthritis, are in general not good candidates because both of these medications, as well as uncontrolled diabetes, severely interfere with the patient's ability to heal implants. Therefore, as long as the patients have uncontrolled diabetes or are taking the medications that I described, they are not candidates for the all-on-4 procedure. However, if diabetes is under control and they're taken off of the medications, then it should not be a problem to proceed. Another class of medications that can contribute to the negative outcome with the all-on-4 surgery are so-called bisphosphonates medications that are typically prescribed for patients with osteoporosis. If the patient is on these medications, one has to keep in mind that the long-term success of this procedure is greatly impaired because although the medications do have a wonderful effect on keeping osteoporosis in check, they also negatively impact the healing of the bone around the dental implants. Patients who have had radiation as part of the treatment for the head and neck cancer are also not very good candidates for the all-on-4 procedure because these patients oftentimes have the jawbone which has been radiated to the point where the bone becomes hypovascularized, meaning the blood supply to the bone is severely limited. This, of course, will also have a negative effect on how the implants are healing after placement, and the patient most likely is not going to have a good outcome. Other than the medical factors that I just described, one of the most important things to consider when talking about whether a patient is a candidate for the all-on-4 procedure is the volume of the bone that is remaining in the jaws. The implants function best when they're surrounded by good quality healthy bone, and if the bone is present, then the implants can be placed relatively easily, and the long-term prognosis of these implants is really good. However, if the bone volume is limited, such as for patients who have been wearing dentures for a long time, we're talking 15 to 20 years, they may not in fact have enough bone volume to allow for a placement of implants in the all-on-4 configuration. However, not all is lost for these patients. They still have a few options. One thing to consider would be grafting or adding the bone prior to implant placement. In addition, zygomatic or cheekbone implants can also be considered if the patient is interested in the all-on-4 procedure.